You know, when we think about brushing our teeth, our minds usually go straight to getting a wider smile, maybe some fresh breath. But the health of your mouth, and I mean specifically your gums, it's actually like a powerful window into what may be going on in the rest of your body. So let's dive into that connection.
Okay, let me just start by asking you a question. Have you ever been brushing or flossing and seen a little bit of pink in the sink? Yeah, it's incredibly common, right? It's something pretty much all of us have experienced at one point or another.
And look, for most of us, it's just, well, it's an annoyance, a little sign that maybe we need to be a bit more careful with the toothbrush. But what if I told you that for a certain group of people, that exact same little drop of blood represents a whole different level of danger? This is where things get really interesting.
That little bit of bleeding is something we really shouldn't just brush off. Think of it like a warning light on your car's dashboard. It's our body signaling that something's up, connecting our day-to-day habits directly to our long-term health. So what's actually going on when that happens? Well, the clinical term for it is gingivitis, and all that really means is an inflammation of the gums. It's caused by the buildup of bacterial plaque, that sticky, invisible film of bacteria that's always forming on our teeth. If you don't get rid of it, it starts to irritate the gums, making them red, swollen, and, you guessed it, much more likely to bleed. Now, the good news here is that we have a whole arsenal of stuff designed to fight back. Modern toothpastes are packed with these really powerful antimicrobial ingredients. They don't just clean your teeth, they actively hunt down and eliminate the harmful bacteria that are causing all that inflammation in the first place. But of course, it's not just about what's in the toothpaste tube. It's also about the tools we're using and how we use them every single day. So let's take a look at the two main players in our interdental cleaning toolkit and see how they really stack up against each other. The classic debate, the little interdental brush versus good old-fashioned dental floss. Both of them are designed for the exact same critical job, getting into those tight spaces between our teeth where a regular toothbrush just can't reach. The best choice? Well, that often comes down to the size of the gaps between your teeth and, let's be honest, which one you're actually going to use correctly and consistently. So when researchers put these two tools head-to-head, which one comes out on top? Well, according to a major systematic review, the interdental brush is actually more efficient than floss at reducing both bleeding and plaque. This is probably because those little bristles can scrub a much wider surface area between the teeth more effectively than just a single strand of floss. But here's the thing the research is crystal clear on. The absolute best tool is the one that works for your mouth and that you will use every single day. Okay, so up to this point, we've been talking about a very common, pretty manageable health issue. But now we're going to make a hard pivot. We're going to look at what happens when bleeding isn't just a sign of a little inflammation, but a symptom of a much, much more serious underlying condition. I want you to imagine that same pink in the sink again. But this time, instead of it stopping after a few seconds, it just doesn't. This is the daily reality for people living with hereditary bleeding disorders like hemophilia. For them, oral health isn't just important. It can be a matter of life and death. Let's put a number to that reality to really understand it. People with hemophilia can experience, on average, nearly 30 significant bleeding episodes a year. Just think about that for a second. That's not a paper cut. We're talking about a serious bleed that needs medical attention happening more than twice every single month. And this is precisely why oral hygiene becomes so critical. Around 1 in 10 of those serious bleeds happen right there in the mouth. A simple bite to the tongue, a cut from a sharp tortilla chip, or even just severe gum inflammation from gingivitis can trigger a bleed that becomes incredibly difficult to control. This changes everything. A simple dental cleaning, getting a filling, even getting a local anesthetic, it's not routine anymore. Every single procedure, no matter how minor it seems to us, has to be meticulously planned out to manage the very real risk of uncontrolled bleeding. Just look at this table from the World Federation of Hemophilia. It perfectly illustrates the stakes. A dentist can't just pick any old anesthetic technique. Certain types of injections, like the inferior dental block that's used for lower molars, carry a really high risk of causing a deep muscle bleed. And that means they require what's called hemostatic coverage. The patient actually needs a transfusion of clotting factors beforehand. We are talking about meticulous, high-stakes planning for what most of us just think of as a simple numbing shot. So if even the most basic treatments are this risky, what's the solution? Well, the answer is actually simple, but it takes incredible discipline. It all comes down to prevention. For these patients, prevention isn't just good advice, it is literally a lifeline. This is the core philosophy right here. The absolute best way to manage the risks of dental procedures for someone with a bleeding disorder is to do everything humanly possible to make sure they never need those procedures at all. And this master plan for prevention, it's built on habits that probably look really familiar. It's the same advice we all get, right? Consistent brushing, cleaning between the teeth, cutting back on sugar, regular dental visits. The only difference is the urgency. For someone with hemophilia, skipping these steps doesn't just risk a cavity, it risks a procedure that could easily land them in the hospital.
And this is not something that can't be managed alone. As the World Federation of Hemophilia puts it, successful care is all about teamwork. The dentist and the hematologist, that's the blood specialist, they have to be in constant communication, working together on a plan that keeps the patient safe, both in and out of the dental chair. So we've kind of come full circle, but hopefully with a totally new perspective. When you see how absolutely critical these simple, everyday habits are, for some people, it forces you to ask a bigger question about your own routine. Is brushing your teeth really just about having a pretty smile, or is it a fundamental part of protecting your entire well-being? It's definitely something to think about the next time you pick up your toothbrush.